We begin with the COVID-19 situation in South Korea. The country saw the new daily tally top 200,000 for the very first time on Wednesday. And although it's not expected to go that high today, it will come close.
Yes, for more on this, we have our reporter Kim Bo-kyoung here in the studio with us. Good morning, Bo-kyoung.
Good morning.
Let's start with the local infections.
Well, we're expecting to see a daily tally near 200,000 mark because as of 9 p.m. Wednesday, South Korea reported 186,169 new infections. That is 18,791 fewer than from the same period the previous day. Though we are seeing a drop, it is still 24,787 more than a week ago and twice as many as was reported 2 weeks ago on February 16th. Though the number itself seems shocking, according to health authorities, the pace of new cases is slowing down somewhat, though further observation is needed to see if this is a part of a clear trend.
And we're also hearing cases of what is being labeled stealth Omicron. These infections are on the rise in Korea as well.
That is right. That is what was said by a spokesperson from a Korea Disease Control and Prevention Agency during a briefing on Wednesday. Health authorities say they are keeping a close eye on the BA.2 version of Omicron, nicknamed stealth Omicron. Researchers say this variant is much more contagious than the original. The number of cases of stealth Omicron is increasing, both domestically and abroad. In South Korea, among the number of locally transmitted cases, the detection rate for the BA.2 version Omicron rose to more than 10% in the fourth week of February. It was just 1% in the first week of that month. When it comes to imported cases, it has risen to more than 18% from 10%. The official said that as the number of stealth Omicron cases increase, it will be carefully monitored to determine any impact on the number of confirmed cases or the peak of the pandemic.
Now, Bo-kyoung, what about the government's preventative measures for children and pregnant women? What are they?
Well, as the number of young children testing positive goes up, the health authority has designated specialist clinics to treat kids with COVID-19. The health authority is working with the Korea Children's Hospital Association to designate 26 children's hospitals that run respiratory clinics, and it will offer 1,442 sickbeds for those who need them. Children under the age 11 will be given priority to see a doctor or be hospitalized if required. The list of these specialist clinics will not be open to the public in order to avoid any confusion. Rather, those in need will be guided to visit the hospitals. The number of children with COVID-19 between the ages of 5 and 11 made up more than 12% of cases in the fourth week of last month. And meanwhile, the government has asked hospitals to let expectant mothers give birth even if the hospital does not have negative pressure delivery beds, as there is a shortage of those beds due to the surge in the number of cases. Instead, the government is to cover any associated prevention costs for those hospitals.
Now, the policy in Korea is that people who have symptoms of Omicron are to test themselves at home using these self-testing kits that you can purchase from pharmacies and then possibly then going to some kind of screening center after that. However, there are some concerns being raised over the accuracy of these at-home testing kits. Why exactly is that, and is there anything that can be done in this situation?
Well, there are lots of people, like you said, who have tested negative through self-testing kits, but tested positive when having rapid antigen tests done at clinics. The Korean Society for Laboratory Medicine says the results are not that precise, with a detection rate of only 20% if people do it themselves, and 50% if done by medical staff. That is because at the early stage of the infection, one needs to get the sample from the deep inside the nose, that is more than 10 centimeters in, but self-testing kits can only get the sample from near the nostril. Besides, it is difficult for people who have no anatomical knowledge of the nose to do it properly. Therefore, medical experts recommend those with symptoms to get rapid antigen tests from doctors' clinics.
But despite this current situation, we hear that authorities are planning to ease some social distancing restrictions.
That's right. As you said, the government is considering easing social distancing measures as it sees any strengthening of measures to be ineffective. Originally, social gathering caps of a maximum 6 people and 10 p.m. shutdown orders were to remain until March 13th. However, health authorities said that as the government needs to put all efforts into minimizing the number of critically ill patients and deaths, rather than the number of the cases, the country is mulling over easing distancing measures. The consideration also takes into account the low fatality rate and the damage small business owners are dealing with. The government might change the rules as early as this Friday after consulting with medical experts, business owners, and local governments.
Right, so it seems like we will have to wait and see. Thank you so much for your efforts, Bo-kyoung.
Thank you.